Morning, everybody, and thank you for joining us for our Getting on Board Evidence-Based Programs and Practices webinar. I'm Peggy Gleason, Administrative Project Assistant for Community Action Partnership of Oregon. Most of you are familiar with our presenter, Ken Ackerman. Ken's the creator and manager of virtualcap.org, which was launched in 2002, and he's a great resource for community action agencies around the nation. His involvement with community action began in 1971 as a VISTA volunteer in rural Virginia. Ken served as executive director of a community action agency in Virginia for almost 25 years, after initially working as the agency's chief planner. He's a certified peer reviewer for the Award for Excellence, Pathways to Excellence in Community Action, and has provided interim management assistance and direct TNTA to community action agencies across the U.S. This presentation is supported by funding through Oregon Housing and Community Services, CSBG funds. For those of you who are new to our webinars, I'd like to go over a few things before we start. First of all, we have muted all attendees to avoid feedback problems. For audio, you have your choice of using the telephone call-in number or your computer microphone and speakers. When using your computer, a USB headset is recommended. You can switch between telephone and computer audio at any time during the webinar. If you're having trouble hearing or viewing the presentation, or if you wish to ask a question, you can do so by typing a message in the question area at the bottom of the control panel. Then you click on Send Message to Staff, and then click Send. I'll respond to any questions that I'm able to during the presentation, and then Ken will pause the presentation occasionally to answer questions specifically for him. Ken will also allow time for questions at the end of the webinar, and if you prefer to ask a question at the end of the presentation by using audio, click on Raise Hand button. It's on the Grab tab at the top left side of your control panel, and then I'll unmute you. There'll be a copy of the full presentation with live links sent out by email after the completion of the webinar. At the end of the webinar, you'll be prompted to fill out a short survey. Please take a minute or two to offer your feedback. It's very helpful to us in planning our future webinars. CAPO is very pleased to offer Ken's webinar. I'll go ahead and hand the controls over to him, and I hope you all enjoy the presentation.
Great. Okay. Thank you very much, Peggy, and welcome everybody. I truly appreciate the opportunity to present on evidence-based programs and practices. Before we get going, I'd like to do a quick poll here to see who we have participating with today's session. So if you take a moment, please, and select one of those options that fit your role with your agency. I'd like to see type of work you're doing with your organization. Okay, give you 10 more seconds or so and we'll close it out. Okay, very good. So what I'm seeing, let me share this with you, the results of our poll. It looks like we have a blend of people doing administrative and planning work, about half directly involved in program management, which is great, and also a core group of folks who are on frontline staff doing direct services. So I appreciate your helping me learn a little bit about who's involved. I hope the material that we share today will help you no matter what your role is in your agency. So here's an outline of the areas that I'll be covering through the next hour. First, I'm going to provide some background information on why we're even talking about the whole concept of evidence-based programs and practices. Along with that, then, I'll be helping with some definitions, looking at what the differences are between an evidence-based program and an evidence-based practice. The big part of the presentation today is based on two research briefs, research to results briefs, that an organization called Child Trends has published. You'll be having copies of those briefs that you can refer to, but the other thing that I've done is taken their guidance and basically done a lot of gathering of materials, tools, and resources that you can use to actually go ahead and move along with your involvement in using those resources toward getting involved with evidence-based programs and practices. Finally, at the end, I'll also then be sharing some examples of community action agencies that are currently involved in evidence-based programs. And if you know of others, if your agency's involved, I'm going to be asking you that question as well toward the end. Okay, before I open the next slide, I have another quick poll to run. And this one is to see how many of you are actually directly familiar with what evidence-based is about, the meaning of evidence-based. Okay. Almost everyone has selected one of the options there. I'll give you a few more seconds. And okay, great, thank you. So here we have the results. And as you'll see, okay, so about 3/4 have some familiarity with the notion of evidence-based programs and practices. The rest pretty much may or may not, but I think in participating in the webinar, hopefully we'll have a stronger understanding of what this all involves. Okay, those of you who have been involved with community action for the past 5 years or so probably see what I'm sharing with you here, President Obama. This was quite an infamous day, you might say, in the history of community action. And if we were together in a room, I would ask you, please tell me how many of you remember his comments during his State of the Union address in 2011, where he proposed at that time, as part of his new initiatives, to cut community action agencies by 50%, meaning the CSBG funding would be cut by 50%. And we went through this for several years where the Obama budget included a cut of that nature. And that really didn't come out of the blue. I know it caught a lot of people by surprise. It certainly caught me by surprise. But I wanted to share with you some background with how that came about. In fact, if you look at these particular different materials from the Federal Office of Management and Budget, going back to 2009, in fact, which was 2 years or so before the President's State of the Union that I just referred to. And by the way, on that slide there was an icon that said, listen, when you get a copy of this presentation, these links that you see, these here on this particular slide, it says open, you'll be able to click on them and you can hear that part of the State of the Union address, and you can open up all of these documents from OMB as well. But getting back to the point here, where OMB in 2009, 2010, 2012, 2013 continued on the path to emphasize the importance of building requirements for programs that receive federal funding, and I know this happens also at state and local levels, to really show that there's proven results, that there are positive results as based on the funding that's provided, and a return on investment against that funding. If you look at the top 2009 document from OMB, quoting from that, what you'll see, it says, many programs are founded on good intentions and supported by compelling anecdotes, but don't deliver results. And what came out of that was the desire to really have programs begin to develop data that would show the approaches they're using are effectively working, if not, what kind of adjustments they're making to get to the point where they're back on the path, and actually to defund, so to speak, programs that are not working. These are the latest series of materials from OMB. The one on the bottom, actually, this is a web page from the Office of Management and Budget. You can access all of these different background materials. I happen to highlight two of them. The President's 2017 budget, talking about building and using evidence, as well as making a difference by funding what works, that came out about a year ago. That one in particular emphasizes the various areas of support that the President's budget included that were all evidence-based programs in the areas of home visiting, homelessness, reducing crime and recidivism, and so on. Another parallel effort that's been going on for a number of years was an organization was created called the Coalition for Evidence-Based Policy. You see their link to their website. I must say real quickly that that organization is closed down, and all of its work has now been transferred over to the next one you see there, the Laura and John Arnold Foundation, with their link on their evidence-based policy and innovation initiative. The staff actually are the same. In other words, they took over the entire operation of the original coalition. And what the coalition was set up to do, it's a high-level nonprofit with some very well known and highly regarded board members from different think tanks and university research organizations. They are wanting to increase government effectiveness using rigorous evidence about the term "what works," which I think is a great term, actually, what works. And as you'll see, there are different ways to validate that. And I put in red there the big phrase that the belief that many government programs have been implemented with little regard to evidence. And they then go on to say that some studies have been made showing that there are effective program models. In fact, then, through their efforts and through work at the federal level, there are a number of new initiatives that were launched over the past 4 or 5 years with a lot of funding in them. You may be familiar with some of these. The third one down, in fact, Evidence-Based Teen Pregnancy Prevention Program. There are a handful of community action agencies that are participating in that, and you see the others that are on there as good examples. You know, I added all of these up, and I think it came up to, gosh, something like $800 million on an annual basis, which is quite a chunk of money. So you can explore these if they're something your agency has a focus on or you're interested in learning more about. What I wanted to do here was delineate the different terms that are used, and you'll see they vary depending on who's talking about this subject. This happens to be an issue brief that I put together for the National Association of State Community Services, for State Community Services Programs, also known as NASCASP, the State CSBG national organization. They had some funding from OCS to do some research on evidence-based programs, and they had 4 categories that these programs and practices would be grouped in, and you see them listed there, ranging from the top one of evidence-based practice, which really is the highest level of validation that's based on documented scientific evidence, usually having a control group, meaning that you have some people involved in the intervention and others who are in similar life circumstances who are randomly selected who are not involved, and then you measure the changes that occur with those who are in your program compared to your control group. This is something you don't see very much out on. There are some that I'll be sharing with you, but it is the highest level. And it goes down from there toward evidence-informed practices that's based on research and practice knowledge. There's data behind that. It goes from there to exemplary practices, where you see there's less rigor to it, but it's one that does have data behind it. And there's a way that you document what the results of the program are. And finally, promising practices, which is the lowest level on this list, but still one that is using some information on different efforts that have been effective to actually mold the kind of work that others might be interested in pursuing. So unfortunately, with the time in this webinar, we don't have the ability to go into a lot of detail on these, but as I said, these slides will be available to you as well as that particular report, and you can read into it more. But moving on that, one part of the report that I want to go over today, it's outlined in there, is from a woman named Lisbeth, also known as Lee Shore, who I think is one of the leading thinkers on building a base of evidence to improve outcomes, as this slide shows. And what Lee Shore puts out is that it's not just rigorous scientific database control group comparison that will show you what works. And she's suggesting that you go through a continuum of looking at not only the scientific database studies, but also other research, theory, and what the people in the field actually have found to be effective. And so she developed a paper. You can access this. It was published in the Stanford Social Science Review called Broader Evidence for Bigger Impact. And I like what she says is that no one questions that public funds should go to social programs that work and not to those who don't. I mean, that's a pretty basic starting point. But her point is what we need to determine is what types of evidence should be considered when you determine what works and what doesn't work. And so there you see down the second, the smaller box, that she's saying it's not just randomized trials. Many times those are very expensive and they take a long time to develop the actual data and the results of those interventions. And also they often don't help in terms of when the actual program was operating, where the program was operating, what kind of resources were available. There are a lot of variables that a program that might prove to be very, very successful at one point in time in one community operated by an organization may not be replicable in other points of times in other communities. So it's really a intensive effort to get to the point where programs can be built out and created elsewhere. So here you have Lee Shore's sort of framework of what she believes need to be considered in terms of building this base of evidence. You'll see as we go through the other slides, starting with what you want to achieve, what kind of differences you want to make in your community, the outcomes, the results framework, determining, I'm just going through a few of these bullets here, determining what the core components are that are essential for you to have an effective program or intervention. There's her inclusive evidence base. And finally, as these efforts are developed and put into practice, to continuously do some assessment, and it's kind of basically like the Roma process where you're looking at what your targets are you reaching them, where might you make changes, and then ultimately show your outcomes. Very much like Roma, in fact, which I know everyone in community action is very hands-on with. So getting into the research briefs, I added this one actually from Child Trends where they go through, it's a 3 or 4 page brief, the whole background information on what is intended when you talk about evidence-based programs and evidence-based practices. So I earlier said that evidence-based is looking at collecting data. The gold standard is really where it all is the top of the line, the rigorously tested, experimentally tested, using random controlled trials. And you can notice that last sentence, which really touches on some of the issues. Has this effort been replicated in different settings, different communities? And if so, has it proven to be successful as well in that way? One thing I'll touch on here is the difference between a practice and a program. And you'll hear the term core components quite a bit when you look at evidence-based initiatives. And in effect, the core components are what the practices are. So in other words, if you have specific formats of doing training, maybe you're working in group settings, one-on-one settings, you have so many sessions and you have certain materials that you're using, those are core components. When you have a series of core components that are worked collectively together to meet a community need toward a specific outcome, that's where you build your program. And an evidence-based program is very much geared towards having some structured components that can be replicable, and you would then be very true to those components in terms of running your replication of that program. One thing, another piece that community action agencies I know are familiar with is the whole notion of a theory of change, and that of course shows how you plan on getting toward your intended outcomes. You know, I love the last line on this particular slide above the link there, which seems to me like basic logic, but they make a point in this practice brief of saying evidence-based programs are more likely to be successful than non-evidence-based programs. So you might want to ponder that for a while. They give you some online resources to help you gather more knowledge and examples of evidence-based programs and practices. They focus a lot on out-of-school time programs, but these clearinghouses have, as you'll see later, topical areas that would fit into much of the work the community action agencies do. And then finally, one more time, showing the evidence-based continuum from the most rigorous gold standard down to the lower level, and distinguishing between evidence-based practice, which has scientific data behind it and random control comparisons, versus practice-based, which is something that a local community might say, this meets a need in our community, it makes a difference in the types of risk factors that are being addressed, and it has a positive effect on the people being served and on our community. So there's practice-based evidence that may not have scientific backing that still has a level of what works to it. So here's the main practice brief that I wanted to go over in some detail here. And let me say there are 10 steps in this practice brief, which again you can open and read through it. They divide it into 4 different groupings. I'm sorry, the handout that we sent out, I actually just redesigned this particular slide this morning. And I put these groupings, and I think it helps go through this in a way that will be a little bit more organized than just showing 10 separate items. So the first grouping, planning and assessing readiness. Is your organization in a position to really move ahead? Once you determine that you're in a position to do so, looking at how you find a good fit in terms of an evidence-based program or practice for your organization, getting your training in place and starting to implement the program, and finally, again, to do some monitoring of how the program is operating and doing some modification to improve it along the way. Okay. So the first step is to prioritize your outcomes. Where do you have needs in your community that your programs aren't reaching at the level that you would like to be? And basically, you may have something that's working, but if you look at these different resources that I've added, particularly the Theory of Change video down on the bottom right of this slide here, you can open that. It's a 5-minute video. I think it's an excellent presentation of saying that, you know, we're probably doing some work that is effective, we're doing some good things, but we're really not making the level of difference that we probably could make if we had a little more knowledge of what are the effective ways that have been proven scientifically and otherwise to really reach the outcomes that we're looking for. So the whole point here is not to say so much that our programs are meeting their goals, but to really take a step back and ask yourself, what can we do to really ramp it up in another level? By the way, on the bottom left there, you see a logic model from Parents as Teachers program. That is one of the highly regarded evidence-based programs you may be familiar with. You can access their logic model and other materials, which I'll be showing you along the way here. And one piece, the Theory of Change, which actually in Region 10 is known, is another way to looking at your outcomes, of course. And we're possibly finding some other models that have been proven to be effective, maybe. Step 2 is your readiness assessment. Now, I really like this step. I think this can be done regardless if you're interested in evidence-based programs or if you just want to do some things that are going to elevate the work in your organization. And there are 2 parts of that I want to share with you. I'm going to show you now the change readiness assessment that's in the middle of that slide, and you can see It's a series of questions about change and about teamwork in your agency and leadership in your agency. It's an 8-page document if you look at the top here. It talks about all levels of your organization. It talks about other organizations in your community. In terms of assessing where you are and how you are culturally as an organization in terms of looking at things in a new way and building upon the work that you're doing. So I think that's an excellent tool. Another one that's on there on the right, which is the EB Practice Skills Assessment, EBPSA tool it's called. I'll open that up for you here. And here we go. It is comprised of 10 subscales, and hopefully you see that on your screen. This one actually was scientifically developed in terms of collecting data on the effectiveness of the particular instrument that this is part of. And so you can see the 10 subscales on here, different areas: organizational support in terms of building your evidence-based practices. Are you in a position to really make that work? And then down to the specific level of your operations in terms of interviewing, communications, teamwork, and so on. Again, I think this is a valuable tool regardless of whether you're interested in evidence-based programs or other way. But basically, is your agency in a position to change and take part in this type of an effort? Finally, step 3 is getting support from both within and outside of your organization. And in this particular slide, there are some tools here showing on some of the questions you have to ask yourself in terms of what it takes to get the type of outside support that will make a difference in making this effective or not. And let's see what I have here. So here you go. You can see again the areas that covers in terms of building support for what you're doing. And as you know, building support involvement partnerships is part of the CSBG organizational standards. So this could be useful to you, as I said earlier, besides with evidence-based programs, just in terms of working effectively, getting other groups involved with supporting and participating in your efforts. The other tool here is a short 2-page kind of survey you can take for yourself in terms of determining where your partnerships strategically are to help build the work that you're wanting to begin with evidence-based programs. So the next group here has to do with creating the perfect fit in terms of identifying evidence-based programs and practices. You have quite a few places where you can access clearinghouses. The video on the left is about, not quite a 20-minute video. And what's good about that is they talk about how different initiatives may fit your organization conceptually in terms of being relevant to the needs you want to address and what you have to accomplish, but also is it practical in terms of is it feasible with the resources in your organization, the capacity, the climate in the community, and is it culturally appropriate for your setting compared to where it was first put into place. And so here you have your different questions. A lot of these are from different groups, but they really look very similar, so you might want to glance at a few of these and determine which ones are best for you. So here's the one I was showing you on the left there. And you can see this goes back to step 1 actually. What are the outcomes you want to achieve? How do you identify your program or practice? What evidence has been given that it's an effective program? Does it fit with your organization and community? Do you have the capacity and resources? And are you in a position to monitor, make improvements as needed, and sustain it in the long run? Those are your 6 pieces that I think you've heard some of in some of these slides already, but I wanted to go over that. And then you have a similar checklist there from and HHS, the Substance Abuse and Mental Health Services Administration, SAMHSA. And this is a good one in terms of is the population that you're working with relevant to the intervention that you're considering, or vice versa, actually, is the intervention relevant to the population? As I said a few seconds ago, is the setting relevant to where you're doing it, culturally appropriate, and so on. So these are very simple presentations in terms of what to consider, but they're important conversations that you need to have within your organization and outside your organization to see if the models that you're looking at are appropriate. There are various clearinghouses. Here's a really good one. It's an online clearinghouse from a group called Results First, which is from the Pew Charitable Trusts. Some states are moving into more work with evidence-based programs, and so this Results First is where that's often brought together. So they have these, you can see there are 8 clearinghouses shown on the left. You can open up the database either online or an Excel spreadsheet and begin researching some of the examples and models that they have identified. There are ones that are specific to programs. So here are 2, one on teen pregnancy prevention and the other on home visiting. 2 of those that were listed in the funded types of projects that I went over on an earlier slide. And there's the CSBG Training and Technical Assistance Resource Center. If you look at the slide over on the right, I outlined in blue, you can see there are filters for evidence-based or informed programs, as well as for exemplary or promising programs, with about over 100 of the first group and over 200 of the second. And you could also, as you'll see on this next slide, filter according to outcome categories up on the top right, or different areas within your organization, target groups, what kind of setting you're in, ages, and so on. So you can register, there's no charge. You can access the resource bank and do some searching through that. And finally, I put together a packet of different clearinghouses there. You see I have 7 of them. And in that packet, yes?
We're not seeing the slides that you're
oh my gosh.
about.
Hello?
It's on NREP right now.
No, we're good. We're good. I'm going back. I apologize for that. Whoa. I'm getting there. Okay. That was a big goof on my part. Here we go. I think I'm not sure where we were.
Go back one. Oh, it said NREP at the top.
Okay, I think we were. I did the readiness assessment.
Okay, yeah.
Okay, I apologize. Okay, you will be getting a full set of these slides that have these links on them. They probably will go out this afternoon. So hopefully anything that I failed to have on the screen will show up. I apologize for that. Here we go. Here's the NREP. So there are the checklists that I opened for you. And getting into the clearinghouses, that's where I messed up. I'm sorry. The Excel spreadsheet and the online clearinghouses there. The program-specific clearinghouses is on this slide. The CSBG TNTA Resource Center with free registration, and as you see down on the right, the evidence-based and evidence-informed, as well as exemplary or promising practices, and the filtering that you can do either by outcome categories at the top right. You can check as many of these together as you desire. Outcome categories, age, target groups, urban, rural, and so on. And finally, the packet that I've put together where I've tried to build out each of these clearinghouses. And if you look at the ones on the bottom, on the left, for example, you'll see the level of focus topics that are included. And I would suggest that every agency will find one or more areas of involvement that this particular one and many of the others offer. Okay. again. So adaptation, this is key. If you look at these slides, you can make adjustments to the program, but there are some pieces, and again, going back to that term, the core elements that are really not changeable. In other words, if you want to be true to the way the program was designed, you shouldn't be tinkering with the core elements. And if you look at the blue outline box, you can see there's some acceptable adaptations that are shown on this particular resource in terms of you might have different levels of activity in terms of certainly different languages. If you're working with different groups who speak different languages, that would be obvious, I'm sure. You may change some of the images in the program, modify different activities, but there are some that you shouldn't. And really what I want to open up here to make this a little more easily seen is this sheet here. The two resources in the center of the slide, the one in the center and the one on the right, excuse me, have what are referred to as green light, yellow light, and red light adaptations. And very simply, you can imagine the ones that are reflected under green light are meant to show you, okay, these are the ones that are typically looked at based on the local scene. What do you need to do to really get that program working properly with the setting that you're in and the groups that you're working with? The yellow light are the ones that, with some caution, just as yellow lights are meant to be, you can consider modifying. But when you make any modifications, and particularly in these areas, it's important to track the effect that those modifications or adaptations are having on the results, the short-term and intermediate results in particular that you're carrying out. And finally, red light adaptations are no-nos. Okay, so I like the way they, those two have put that together, and I am going back, I hope, to the slideshow. How's that? Did it that time. Step 6, underneath the creating the perfect fit, is to find people who have expertise with the program or practice that you're exploring and get some technical assistance and or information from them. I happen to show up here 3 evidence-based programs, some of which you may have heard of: the Nurse Family Partnership, which is a home visiting program, Ciudade, which is a teen pregnancy prevention program, particularly geared toward Latino youth, and finally Parents as Teachers that I had on an earlier slide. And in fact, if you can open these links and you'll get some great material from them if these interest you in particular. But of course you could do an internet search, and from that point learn more about some of the frameworks, the structures of these programs, and so on and so forth. Now, of course, in some cases, if you're going to do a proven evidence-based program, you're going to have to pay for it, okay? So that's a whole nother question. But in many cases, community action agencies, as you see at the end, are participating in programs such as these. Staff training and coaching. This slide, in the next few, I think, again, you can put this to work for you today in terms of the resources that are here. And the whole notion of coaching is really becoming an elevated focus on helping develop staff to be as effective as possible. And if you're not familiar with coaching, I would certainly encourage you to learn more about it and to use some of the tools that are here. It's basically doing one-on-one work with staff to help them develop the skills and then to do some monitoring and reinforcing along the way. So you can see what some of the steps are for coaching here. If you open up that research brief that I added, there's some more information on it as well. And these next 2 slides are some templates that you could use for staff training plans as well as coaching efforts. So why not take advantage of these? Certainly with an evidence-based program, these are critical, but I think with any type of staff training and development, this fits in really well. Step 8, which is now into the training and get going as well, along with Step 7, is looking at what you have to do within your agency to change your structures, maybe your job descriptions, the way you're staffed, and how your resources are allocated to institute an effort such as this. The NIRN, which is the National Implementation Research Network that does a lot with evidence-based programs, basically has come out and said that having a team put together, an implementation team, is a vital part of this. So very much encourage organizations that are moving this direction to find some ways to put together such a team. And in fact, the studies have shown that with a team, the success is much more likely than without a team. You know, beginning in initial implementation, there was a quote that I saw on that saying that if you don't have effective implementation strategies, it's like developing a serum without a syringe. In other words, you have the cure, but you don't have the delivery system. So what this this whole area, Step 8, is about is putting your agency in a position to launch the program effectively, to support the program, and to carry it out on a continuous basis. The last phase of learning, reflecting, and improving has to do with evaluations. Of course, community action is part of the ROMA process, as we well know, and it has to do both with formative evaluations as the program is underway, the program process, as well as a fidelity assessment in terms of where you are in terms of your adherence to the program model. Ultimately, the outcome evaluation, which is shown there as well, shows where you are with the level of success and outcomes of your program. There's some resources there that you can pull up to help you with that, and a few others here. Okay. Last step is your basically operating as a learning organization to look at how you're doing with your efforts. This, again, is the cycle that we've talked about to see where you've done well, where you may need to tweak or modify what you're doing, find more training and technical assistance, and continue to build your program and improve and do better and continue to do better. So those are your 10 steps for implementing evidence-based programs. Along with that, then, I gathered information on what's viewed as the 6 drivers of success once you have your program. And so I'm going to go over this fairly quickly. And let me take a deep breath for a minute, if you don't mind, okay? And just see a couple of polls that I have still to ask you to help out with is, where are you in your agency in terms of accessing information from the field on effective programs and practices? Something that you routinely do? And these questions that I've put together aren't necessarily right or wrong questions. They're also food for thought. So in other words, these are areas that you can get involved with to a higher degree as well. Okay. So keeping up with the research that's done, with the best practice programs, evidence-based programs, and all of that. I'll give you a couple more seconds, and let's close that out. And I will share that with you. And it looks like about not quite half do this on a routine basis, and the other half may not be sure, but it's something to consider further. Okay? Okay. And closing that out. And I have another poll for you. Okay. This one asked, the first one was about researching and keeping up with what's going on, and this one has to do with focus on outcomes in your agency. And it's really throughout the agency, as you can see. And of course, that is something that is part of ROMA, and just at the varied levels that you may be involved. I'll give you a few more seconds here, and we'll close that out. Okay. Okay, great. So the results here, about 2/3 indicate yes, and the other third or so, again, not sure, perhaps not. Okay. Now I need to find the slides that were on with the 6 drivers of success, and I think we're right here. Okay, so you can see them listed, and the first one, staff selection and recruitment. In this particular case, those are viewed to be key components of implementation, both at the program and organizational level. If you read Good to Great in the Social Sector by Jim Collins, it's a very thin monograph. You'll see the whole notion of having the right people in place is one of the chief factors, if not the chief factor, of organizational success. So staff selection and recruitment, and you can see the different questions to consider in that area. Staff training and pre-service and in-service. And this gets to the slide that we went through a few moments ago about training and coaching. And you see demonstration of skills, that's part of coaching in the top box there. Having some awareness of the theory that's behind the program, so staff understand the underlying principles, and then practicing and giving feedback. And this is on a continuous basis, not just on a momentary basis. I like the very last line on this slide where it talks about giving staff opportunities for quality interaction. Think about that, and ways for staff to have a dialogue. If you have different people operating the program in different locations in your service area, having them get together and talk about what they found to be effective, what they're having issues with, and moving ahead to respond to how the staff is viewing their work and the efforts, the challenges, and the successes that they have. I think that is certainly key. So this slide has some good information on it. There's your coaching, mentoring, and supervision, carrying on with training in the operational phase. The box at the bottom in the middle, I love this part here. It says, training practitioners without providing follow-up coaching on the job is sometimes referred to as the train and hope approach. And research has shown this approach to be ineffective in achieving practice change. So in other words, follow-up coaching, and you'll see on an upcoming slide here what the research points out on that. Okay, so again, they look at when training occurs, the evidence, what is the knowledge that's developed, can the skill be carried out, and is it used in the field? And there you go. Training without coaching, in this case it said 0 to 5% demonstrated actual use of the new skills. With coaching, 95% demonstrated use. So there's some good evidence of the importance of coaching. Internal management support is a fourth driver for success. Whether the policy's in place, the staffing structure, the focus on outcomes, critical to maintain that focus on a continuous basis. Not just once a quarter, not just once every 6 months or once a year, but continuously. And on an individualized staff level as well. If you read Working Hard and Working Well, which I can help you, its free copies are available. They have a great framework for a focus on outcomes, managing performance toward outcomes. And you can see the different elements of internal management support in the larger box at the bottom. Staff recruitment and training, coaching, interactions among staff, which was pointed out a moment ago, having data, focusing on outcomes, and identifying what the barriers are. These are all very essential parts of building effective programming. Systems level partnerships, at the bottom there's a link to an issue brief on that by itself. Working with your external partners, I would say strategic external partners, to support the work that you're doing and to help you sustain your effort with resources over time. Okay, so your partnerships in different fashions here. And finally, your evaluation. Again, the loop that we've talked about a few times. You can see the both as the program is in operation and ultimately what the outcomes are, both at the staff and program level. And you notice on the left the 6 stages of implementation. The interesting thing about this is that's a 2 to 4 year typical process for an organization in terms of implementing an evidence-based program. Okay. This shows the success of implementation. It gives you 3 forms. One is on paper where you develop everything in place but then stop there and the program never gets off the ground. The second one is where you have everything in place but you don't have it implemented across the board. And finally, the third one is implementation for impact, where everything is in place and you have a very tight structure to adopt the program and to carry out the program. And basically the equation here is if you have effective intervention practices plus effective implementation practices, your likelihood for success is much higher. And if you would like to learn a little bit more, here's a link on a planning process that SAMHSA, the HHS agency, has put together. So we're getting close to winding down here. Before I get into this, let me see, are there any questions, comments that I have?
I've had a few questions, but I was able to answer those. Mostly they're just about whether we'd be sending out the slides afterwards, and yes, we will, and we'll also be sending out a link to the recording. And I do have one hand raised. Did you want her to ask her
that'd
question?
be fine. Should we unmute? Is Carol there? Do you have a Carol Douglas? Oh.
I think we both unmuted her at the same time. Okay, Carol, are you there?
Maybe not. Maybe, I don't know. No?
Well, maybe she raised her hand by accident.
Okay, anyone who would like to. I have a couple of slides here showing community action agencies that are involved with evidence-based programs. Parents as Teachers has come up a few times through the presentation. You can see I have almost 20 here. This is not meant to be an exhaustive list. There could be 20 more, but these are ones that I'm aware of. Happy to add any from those of you involved in the webinar if you know of others. Okay, and if you're interested in this program, you can contact these agencies. Virtual CAP has a directory of local agencies. You can get in touch with me or get them through our listing. So Parents as Teachers, the Nurse Family Partnership, you saw that on an earlier slide. Here's an agency in Pennsylvania that's been doing that. The Teen Pregnancy Prevention Program, Ciudate, from California, Strengthening Families, Positive Parenting, and so on. So you can see there are, about a dozen altogether that I've put out here as examples. And again, it doesn't mean this is the be-all and end-all. These are all links, okay? So if you are interested, you could go to learn more about this program, or you can see the links there are live. So I have a poll, just out of curiosity. Tell me, if you would, is your agency involved currently in an evidence-based program? Okay, doing okay. Give you a couple more seconds, and we're going to close it out and I will share that with you. And it looks to me like about almost 70% said yes, so that's impressive. I'm very impressed by that. If you share with me which ones you're part of, I'd love to know. Add you to our list, or however you could get me that information. If you'd like to put it in the chat or question box, that'd be great. So, okay, I have to go back now and open up the PowerPoint. There we go. Okay. And other than that, what I have here is some general information about Virtual CAP. It's a flyer showing the level of information available on virtualcap.org. I have a number of slides on our publication that started last year called Virtual CAP Roundup. You see the covers of these slides. You see the different sections that each issue includes: a focus topic, successful funding initiatives, innovative programs, basic news from around the country, some other relevant resources, anti-poverty materials under Did You See? And we just added Brighten Your Day, something that I think the one we did in our last issue supposedly would brighten your day by at least 47% if you took a look at it. So I hope you'll consider subscribing to it. It helps sustain Virtual CAP, but most importantly, it's our way of getting out regularly information to the network. We have over 300 subscribers now, and would love to have agencies who are on this call and others take advantage of this material. Okay, and you can certainly keep up with us through Twitter and Facebook, and hopefully be interested in our next webinar coming up in early June on collective impact. So I have brought us in a little bit ahead of time. We still have a few moments if you have any further questions or comments, or if you'd like to share your experiences in your involvement with evidence-based programs. It's open for anyone who would like to do that. We have an evaluation that will come out to you after the webinar. As Peggy said at the beginning, please take a moment to give us your feedback, comments, other questions. And at the first slide, you have my contact information, both email and telephone. Feel free to get in touch with me about this or other areas that your agency might be looking for material or information.
And I just wanted to say that we'll be sending out the registration announcement on the next webinar soon, so everyone keep your eyes open for that. And thank you very much, Ken. You really provided us with a tremendous amount of helpful information and resources today. And as Ken said, we'll be sending out links to the recording and to the slides for all of you to share with the rest of the people in your agencies.
Okay, thank you. And thank everyone for taking the time to join us.
And please don't hesitate to let us or Ken know if you have any further questions. Everyone have a great day.
Okay, goodbye now.
Bye.